Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, hello, hello. Welcome. My name is Abby Tyler. Welcome to the show. Uh, Happy Tuesday to you guys. Hope all is well. My name is Abby Tyler. Sorry. Okay. And my disclaimer. I'm a provider, but I'm not your provider. So whatever I say here should not take the place of you seeing your own doctor before making any changes to your regimen. As you can see today, the topic of the show is 6 reasons to get a second opinion. Okay, so I was trying to share the show. Please share the show too. If you're watching, please share the show. Just give me 2 seconds here. Let me just go in here for a second. I'm going to lower my screen here. And okay. Alrighty. So, welcome to all of you watching me from Abby Tyler's Healthy Living page in the group and Focus on Liberia and YouTube. Welcome, welcome, welcome. Thank you for joining me today. And also for those of you, I know people are saying that they weren't getting the alerts and notifications. Please make sure you hit the follow button so you can get your alerts so you don't miss any shows. Please share this show. Please, if it's possible, please share it. So I will get right into it. So we talked about the show's about 6 reasons to get a second opinion. So as I put my good old glasses. Okay. So I did a show a couple of weeks ago about making sure that you're not diagnosing yourself off the internet. So if you missed that, go back and watch that. So that goes along with the theme of the show today. We all go to see our doctors, our providers. Are you seeing a nurse practitioner? You seeing your physician, or you seeing a physician assistant? And sometimes, you're a little skeptical of what they're telling you, and especially now, considering when the prevalence of so much information in the internet, and people can put other things on and say, okay, well, I went to my doctor, he didn't prescribe that. I went to this one, he didn't do this. So there's so many, and this thing, even now with the truth now, like even if you see definitive truth, objective truth, and people are still saying that, okay, no, that's not true. And I don't think my doctor's telling me I need to, this other person said this, other person said that. So it's easy to become skeptical in the day and age that we're in now. And also, and so it's hard to distinguish who's telling the truth, who's telling it, even though you know that these people who you're going to see, they're educated. So again, like I said, go back and watch my shows about the dangers of getting your information from the internet. Okay, so and people make mistakes. Okay, doctors or medical professionals, we're not excluded. We're all humans. We don't, and we make mistakes and all that too, but we do our best. So when we're presenting any information to you, we're doing your, you come there, we're doing your, again, like I said, I did a show also on HPI, meaning when you come to the doctor's office, the problems you're coming into, and also when you go into the hospital too. So we get all that information from you. We look at your records, we look at your past records, we do test results, like maybe blood tests. We also do imaging, maybe if you need to have a chest x-ray or a CAT scan or anything, we do all of that. So when we bring the information to you and saying, this is what we're thinking, that's what it is, and this is diagnosis or everything that led us to this, we're not just coming to you and just blowing it out of, how they're saying, okay, this is what we're doing, this is what we're doing. Now, sometimes, again, like I told you before, there are some diseases that have the same symptoms and mimic the same symptoms. So we sometimes it's best, we try to rule out certain diseases, and then it may take a couple of visits for you to come back, or you may have to see other specialists as well in order for them to, every different set of eyes to look at certain things, do additional testing in order to come down with it with the result. So some people might say, oh, well, I went to see my doctor and I don't think they're doing because I had to do all this other tests. And that when I did this and I did this and I did this. Now, seeing and getting a second opinion is not like, okay, like if you came to your family doctor and I said I'm referring you to somebody else, could be because I, when you come to see primary care, we work within our scope of practice, and then we have to refer to a specialist after we do what we can do in primary care, and then we send you some other diseases. You have to work along with the specialist right away. Like if you come to see me and you're having the shoulder pain, and we did an X-ray and the X-ray results came back, I'm sending you to go see physical therapy. You're not going to stay with me. You have to go to physical therapy. And if you need to see orthopedic, we send you to see the orthopedic doctor. So they're not, you can get second opinion at any time. Don't get to the point where you go see your doctor and you're so like, oh, okay, I need a second opinion. I need, if I'm telling you your A1C, if you have diabetes, and your A1C is a certain amount, and you're gonna say, okay, I'm gonna get a second opinion. You're free to go get a second opinion, but at some point you're gonna have to, believe the doctors that you trusting, you're paying money to, and you trust in them. Okay, so one second here. Let me just open up my notes. Alrighty. Okay. All right. So what are some of the reasons that you need to, the 6 reasons why you need to get 6 top reasons? Like I said, I mean, there are many other reasons, but 6 top reasons that you need to go. So let me come in here, open up my screen. Okay. So get a second opinion. All right. No one knows your body like you. So step one, reason one, get a second opinion if you have undergone treatment, but your symptoms continue. Okay. Nobody knows your body like you do. You can come in there and say, okay, we're doing this, we're doing that. Nobody knows your body. And the symptoms, if we're treating you for pain, especially for chronic pain, back pain or something like that, and if symptoms still continue, or you had a cough that's still there, and you say, and the doctor or your provider saying, okay, no, we give you the antibiotic, we giving you steroids, and you're fine and all that, and you still having the symptoms, yes, you can say, I need to get a second opinion. So it may, it be time to seek the advice of a second doctor, a specialist too often, because people don't advocate for themselves. Sometimes, even if you, for us who are like in healthcare, sometimes we'll say, okay, yeah, that was one of my colleagues, I believe them. But if your symptoms continue and it's not going away, and you don't feel the doctor is doing that much, get a second opinion. So step one, reason one, get a second opinion if you have undergone treatment but your symptoms continue. Okay. So, especially with chronic pain, remember the only way to get the treatment that works for you if you get the right diagnosis. Again, like I said, there will be times where you may have to do other testing to get to the right diagnosis. Get a second opinion if you are diagnosed with a rare disease. Again, sometimes diseases are so rare and there's not too much research on there. And going back to where it says, what's even more, and there are nearly 7,000 new rare disorders, with more discovered each year, according to the Genetic and Rare Disease Information Center. So you could be diagnosed with something very rare, and like they're telling you, okay, this is it. And again, you have to do other things before you finally get to it, and you go to see other specialists. Again, when you live in somewhere, let's say you live in, and that's why I say we may send you to a doctor, like maybe in Center City, in where you go, because that's where all the university hospitals are, and they're more up to date with every testing, and they also have a lot of research laboratories and all that, so they are better equipped to diagnose you with something where after you've seen all the doctors that you've seen so far, and they haven't gotten to where, and your symptoms are still there. So they'll say, okay, this is very rare. Let's send you to like a university type hospital where they can do more testing and finally come out to that. And it may take a little while. Some people have illnesses, even if it's not rare. Some people have illnesses or like stomach pain or whatever that's been going on forever, and they've gone to many other doctors, have done many testing, and they still haven't come down with anything, because nothing shows up on all the tests that it's been doing. So sometimes the doctor will tell you, I've done many tests and all that. We've done this, we've put you on different medications, and still that hasn't worked yet. Let's send you to somebody else and see, well, maybe there's something else there that we're missing. And don't think that doctor is not, sure what they're saying. That's the kind of doctor you want, that would say, we've done everything so far, it's best that you go see another doctor, another specialist, or maybe we're not looking at this part, or maybe the research that we need, the information that we need is not there. Some patients have to go out of state to go to somewhere where, like a world-renowned hospital, to get that to get that care, to finally get the diagnosis that they need. Now, I'm not talking about in Liberia, where the healthcare system is poor, where regular hospitals won't be able to do something really minor. Over here, so I have family members, I have friends before who were in, live other part of the state that I live in, had to go out of state, had to go to New York. Some people had lived in other states, had to come all the way to Philadelphia to other hospitals, or like Pittsburgh in the area and like that. So it's important. Okay. So look for doctors and specialists who have treated your disorder and get their opinion. And this will help you, and that you're getting, they will help you ensure that you're getting the best care possible. All right. Number three, get a second opinion if the recommended treatment is risky, especially if it involves surgery, is invasive, or has lifelong consequences. Like if somebody told you, okay, you need to get this and you need surgery. Let's say if you're getting back surgery, anytime they talk about back surgery, there's a chance that you may not be able to walk again because anytime you're messing around with the back, you close to the spinal cord and anything could happen. Now they'll tell you the risks and the benefits. If you're really in a lot of pain right now, you're not doing that much. The surgeon may help you, but they're like it's very risky. And they tell you this is what happened. You say, okay, well, let me just check with somebody else because I just want to make sure. Okay. It's never wise to agree to surgery or any invasive procedure without exploring your options. Ask the doctor and say, okay, what are my options? If I wait for a couple more years, what would happen? Now, if you're walking and let's say you have low back pain and you're having severe numbness and tingling in your legs, you can barely walk, and you're having some problems, if you're having issues with that would always say bowel and bladder incontinence, where you having issues where you're going on yourself, of course, and there's some severe nerve damage. So if they tell you that, but even then, you might say, what are my options? If I wait for a couple more months, what are my options? If I decide I don't want to do this, what are my options? Who else can I talk to? And explain that, and you say you can call the doctor's office and say, okay, I want to come in and be able to sit there and talk about it, face to face. Of course, you're going to be talking to them face to face regardless, but I want to just come there just for that, to sit there and say, what are my options? If I don't do this, what will happen? If I don't do this, what will happen if I do another surgery first, before that? Let's say if you're having knee pain and it's okay, you need knee surgery, you need knee replacement. Well, what if I get steroids injection? What if I do this? What if I wear something else? What would happen? I can't afford to take off from work right now. I can't afford to do that. What would happen if I don't get the surgery right now? So, explore your options and everything before just agreeing to it. Okay. So, get a second opinion if you're diagnosed with cancer. Now, once you get a C word, everybody gets really scared because especially most depending on the cancer, certain cancers won't be discovered until too far gone. And most of the time, if you have cancer or something else, is always discovered when you're searching for something else. Or if like it's breast cancer, maybe you might feel a lump and you may not feel a lump, or you may be losing weight, or you may be having bloody stools, or you're having some headaches, or you're having chest pain, and then they go find out it could be cancer somewhere else and causing the pain somewhere else. So most of these things, if you get the diagnosis and you remember, the doctor's not coming to you with just saying, oh, you have cancer, or we think, they will tell you, these are the kind of things, these are the different options that we have right now. These are the things that we're looking at. We're going to do this test. We're going to do that test. We're going to ask you about your family history, making sure everything. So when we start looking at that and saying, okay, let's go for a CAT scan, or let's go for x-ray, let's go for MRI, because we want to be relative, we want to be definitive when we come to you and saying, this is what we're looking at. Okay, this may look, and we have to get a biopsy. You get a test, we have to get a biopsy. Now they could see something and say, okay, maybe that is what we're looking at. Let's get a biopsy. And when they do a biopsy, it could not be cancer. So it'd be like, okay, let me go through all that just to make sure. But wouldn't you want to make sure that it's not cancer, get the biopsy, and they'll tell you that. So again, try to rule that out. So get a second opinion. With anything serious as cancer, having an input from another expert simply makes sense. Not only can a cancer diagnosis be confusing and overwhelming, but it's also a life-changing event. Therefore, it's important to be as informed as possible about your prognosis. Remember, if you get cancer, where do you see this going in the next 5 years? Where do you see this in 10 years? And make sure you get that. So you get a diagnosis, which is what is happening to you now, and then prognosis. If I don't do this procedure, if I go get a second opinion, what's going to happen? Do I need to be in the hospital tomorrow? Do I need to be in the hospital in the next 6 months? Can I have this test repeated in about a little bit, maybe a couple of months? Even the radiologists, when they read a different testing, they see something, they'll say, we see no, so we see a spot, we see a mass, we see a cyst, or whatever it is. At this point, we cannot say this is what it is. So remember, you're also going to be getting blood work and everything else too. So we'll say, close follow-up in 3 months. Like if I'm reading your results, close follow-up in 3 months. And we'll tell you have to follow up in 3 months, because right now we can say this is what it is, but you have to follow up in 3 months. Now, some people get really scared and say, oh, no, I don't want to do it. I don't want to do it. Don't do that. Please, if they tell you close follow-up, please follow up. I myself, I've been there before where it's like, okay, follow up in 6 months. I'm like, oh, if I don't do it, maybe if I don't want to know about it, then maybe nothing will happen. No, you don't want to do that. You want to follow up closely. So in case if anything there, they can get to it quickly. Okay. So let me see there. Okay, so just keep in mind that no doctor is completely informed about the findings for every single study and trial in the country. So just again, like I said, get a second opinion. Okay, also get a second opinion if your gut reaction tells you something is off. Like, if you're sitting there and they're telling you, and you're like, I don't know. I didn't know something about what you're telling me. I don't believe it. Now, don't be the person who's like so religious and say, okay, this can be. I pray to God to get this result, and this happened. It's possible. I'm not saying there say anything about religion or whatever you believe in, a higher power or the universe or whatever it is that you don't believe in. I've taken care of pastors, I've taken care of priests, I've taken care of nuns, I've taken care of all those people. And they came in there, they were trusting in God, but they still came to, they were in the hospital or they came into the office, and I've taken care of them. So do not say, yes, it's okay to continue praying. And what I tell you, I'll say, I'll do my part. The other person does a part. Everybody else will play their part. God will play his part. Okay. But be smart in your religious thinking. Be smart in your religious faith with God. Okay. Again, I've taken care of many people who are much higher in the clergy or whatever religious institution. So be smart with what you're doing. Okay. So if you're not comfortable with the diagnosis of the recommended treatment, get a second opinion. You should never agree to a procedure or treatment when you don't feel good about it. Trust your gut and gather more information. Ask questions about your prescriptions, talk to your friends, meet with a new doctor. Again, would be the second opinion. Read about your condition, again, with discernment. Don't just open up Google and just, anything can go in there. And don't go on Wikipedia because anybody can do anything in there. And most of these articles, when I come to you guys, I bring my articles where I get my articles from, and also for my training and also for my practice. It's always peer review articles. I never bring articles to you that are not written by other doctors and all that. I'm not just taking it off the internet. Okay. And no one should ever feel like they have to follow the doctor's orders without asking questions and gathering more information. Okay, very important. Few healthcare decisions have to be made. You don't have to, if they tell you, okay, you have to do this now, you don't have to do it that minute. Very few. Okay. If they tell you, yes, we saw your MRI results and it looked like you're going to be in trouble in the next 24 hours, get to the hospital, get to the hospital. Don't sit there and say, well, no, get to the hospital. Trust me, get to the hospital. Okay. Other things to tell you, okay, maybe we have to do this, maybe we'll have to do that. You can go home. I usually would tell my patients, especially older people, and also people who are, and my foreign patients too, who may be a little bit trying to like acclimate to America and other things, and just the fact that when you're dealing with people who are from another country, you have to there's different sets of sensibilities that go along with it. So also, bring your family member in. Let the person who you trust, the person who who you talk to all the time, like your elder children or another family member, bring them in. We can all sit down. I would sit there with the computer and open it up to them and say, okay, there you go. I tell them, I said, come over here, or I bring it to where they're sitting. I said, look at that. You see what this is what we're looking at. This is what this other doctor said. This is what the test results are. When I do my test results with my patients, when they come in for test results, I read it completely like line by line. Okay. And prior to that, I've already read it. So when I go in there and I'm explaining everything, and I say, you look at this, we give them a copy. Also, if you want a copy, we give you a copy. Go home and look this over, and then you let us know what it is that you want to do. Okay. And of course, again, like I said, anything that's outside of my scope of practice, we send it to, refer you to whichever doctor that is indicated. If you came in with stomach pain or something like that, we send you to the GI doctor, or chest pain, cardiac doctor, anything else that I think that another set of eyes need to take a look at. I send you to those other doctors. All right. And then when you see the specialist, then you may also say, I want a second opinion. So that's when you're going to be going from specialist to specialist. And sometimes if you go to once, but let's say if you are having asthma and they say, oh, you have to have surgery tomorrow. And you go to the other specialist and they say, okay, let's try this other testing first. Some doctors like very involved in everything they want to do. Like they will order all these different tests. And some doctors will be like, okay, let's sit and wait a little bit and see how this is going to be. Neither one of them are wrong. It's just that some doctors decide to practice differently, and they all have to practice within in different guidelines that pertain to our specialty. So nobody's saying, oh my God, I went there and I had this big thing. And some doctors might say, okay, I see this mole on your leg. Let's just wait a little bit. And some doctors will say, oh my God, let's take it off. I'm one of those people I'd be like, okay, I don't know yet. If you've been, how long have you had it? Has it changed color? Does it look any different? Is it something that's bothering you? Did anybody ever, did you mention it to any other doctors before? Again, going back to the history of present illness, we're going to be asking all those questions. And then I may say, okay, I'll tell you what, why don't I send you to dermatology so they can take a look at it and see if there's anything going on there? They might say, okay, let's just keep an eye on it, or let's do a biopsy and or do some treatment right now and go on from there. Again, you don't have to make any decisions on it. And when we tell you go to these other doctors, you don't have to go. We don't force you. We tell you, we explain to you the risks and benefits, and then we document if you do decide to go. Okay, so you're not sitting there saying, "Oh my God, this doctor's like you telling me to do this, and I don't want to do it." No, if it feels funny to you, hold off on it. Okay. And the last, when your child is sick. Okay, when the patient is your child, of course, when you're there and your child, especially when they're much younger, like especially even if they're teenagers, they're much younger, and the doctor is telling you, oh, you have to do this, you have to do that. And some doctors, again, certain diseases, they may say wait and watch and see, don't just do something right away. And some doctors will be like, okay, let's just do it right away, depending on the severity of the illness. But anything, again, when it comes back to surgery, if your child's diagnosed with cancer, if it's something that you don't feel comfortable about, if it's something where they tell you this other medication, that other medication, and something that may have lifelong consequences. So basically everything I read before, and if it has to do with your child, if you want a second opinion, ask, say, I want a second opinion. I don't want to do that yet, because I know if I do this for my child, that may cause them to have problems later on in their life. That may cause them, the ability not to go to a regular school, or they have to have more treatment later on. I want a second opinion. Okay. Again, with discernment. Okay. Because people hear that and they say, oh, I'm a little skeptical because I was reading on the internet, or this person said this. Remember, we just had this whole thing with the COVID vaccine where, you the proof there, and people were saying nobody's died in a hospital, nobody's this. I said, come to the hospital that I work at. Okay, there are some hospitals that didn't get too many people, but we did. Okay, we're surrounded by like all these nursing homes, so we got it like tenfold. So when people say that, oh no, 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 this is not true, people are just making it up. No, no, no. So I'm not going to bring the thing about COVID again, but even there's, because of that, and in the past couple of years where everything, people doubt everything now. So again, if you sit there, you put a banana in front of that person and you say, okay, that's a banana. And you'd be like, nope, somebody told me that's an apple. So this is what we're dealing with when it comes to healthcare, because we're telling our patients certain things, and then we have to sit there and compete with everything else that everybody else said. Okay, but again, we give you all the information. When you come to me, I show you, I tell you, I show you right away. Yeah, you want to print it out, I'll show it to you, and you can read it, and you have you can take it and get it checked again. Okay. So now you're telling me, okay, you say, oh good, all right. So if I can get a second opinion, how does that work? Okay, so will my insurance pay for a second opinion? Most insurance will pay for a second opinion, but some of them have restrictions depending on some insurance. I mean, the insurance like really good, and so some insurance that you basically they pay for your physical and maybe one more visit that year. Everything else you have to pay like a whole lot out of pocket. So check with your insurance company first when you tell your doctor, okay, I want a second opinion. Check with your insurance company. Most insurance, you have your card, they have the membership number on the back, membership service number in the back. Call them and say, I spoke to my doctor, I was at my doctor's office, and they told me this is what's going on, and I want a second opinion. How much is it going to cost for me to get a second opinion? And do I have to stay within network? Because most insurance companies have all the doctors that you can go to. And if you say, okay, I want to go see another doctor outside of my coverage, and they say no, you can go see them, you find to go, but you're going to have to pay a whole lot more money. That's up to you. You're going to have to make that decision, and say, okay, and then sadly, because that's the reason why some people don't go to seek a second opinion, because you're talking about hundreds and hundreds of dollars, and how many visits will you have to go to pay that money? They may say, or you may have to come back 3 or 4 more times. Can you afford extra money? So it's not to discourage you from getting a second opinion, but make sure that you trust your doctor, you have a good relationship with your doctor. So if they tell you something, then you can say, okay, I've trusted this person for a while. Maybe I may see a second opinion. And if it, like, again, like I said, if it's something that your gut telling you that this doesn't sound right, or something that's lifelong consequences, get a second opinion. And sometimes you just have to put the money out. You have to put the money out and say, this is my life. I'm willing to pay $400 or $500 more to do this. Sometimes the testing can be a couple of thousands of dollars, and you have to be ready to do that if that's what you really have to do. Okay. And remember to sometimes if you have to go out of state, if it's something your doctor said, okay, the next person that I need you to see is somebody out of state. Sometimes the insurance company can work with you. You might have to put some money out. They will tell you you can be in the hospital for a certain amount of time and how long you be in the hospital for. If you can do tele visit where the person is like on, like I'm talking to you now, and the patient's over there, and I'm talking to them back and forth. They don't absolutely have to be in the office. They'll charge them less because I'm not physically putting my hand on you to examine you. They may charge a little less than that. So it'd be just like a regular telehealth consultation. Some insurance company will do that. Okay. And also, you say, okay, if I ask my doctor for a second opinion, my doctor is just going to sit there and send me to one of the same people who he or she knows. And how sure am I that they're going to be giving me the right one? You can also call your insurance company and ask for other doctors, and you can look in the database of, let's say, if you got heart issues and they say you have to have heart surgery, you can go to American Heart Association, look in the database, and see other doctors in that area that cover you, that take your insurance. You can go, like last week, I talked about sickle cells. You can go to sicklecelldisease.org and look in there, American Stroke Association, American Diabetic Association. You can look there and see. Now, again, like I say, if you're the disease and they're looking at your levels and they're so far apart, somebody's telling you. Nobody would just come up to you and just lie to you. But again, you have to trust your gut. Okay, so how do I ask my doctor for a second opinion? You just say, you don't have to be emotional. You don't have to be disrespectful. You don't have to be rude. Just say, I understand what you're telling me, and I trust you, and I trust that you care about my health, and you want you want me to be healthy. But based on what you're telling me and my family and where I am in my life right now, I have to work. I have my wife, I have my husband, I have my children. I would like to get a second opinion. And if that doctor or provider really cares about you, and most of them will tell you yes. They'll say, okay, this is what it is. Here's the copy, and you can go ahead and get a second opinion, and then go on from there. I mean, I will be like, go ahead and get a second opinion, because especially considering the fact that I want to know that whatever it is that I'm looking at, that is true, or if I have to do additional testing and all that, I will feel better knowing that you got the right diagnosis and you got the right help that you need, as opposed to saying, oh, well, you don't trust me. You think, I went to school and I got this. No, you don't want a doctor like that anyways. You don't. If that person's acting like that, run. Okay. Because but I'm not going to tell you your blood pressure. If I'm looking at it and I tell you your blood pressure is very high, we have to start your medication. Let's test your blood pressure again for a couple more. Come here 2 or maybe a couple of days, and next week we'll check your blood pressure. Eventually, you're going to have to start on blood pressure medication, and you decide, no, I don't want to. That's up to you too, because I mean, you see it there. It is there. Your blood pressure is high, especially if you come in and you're having some symptoms. I'm just going to say, okay, that's up to you. All right. There's certain things that you don't need a second opinion for. Again, you can ask a second opinion for anything, but there's just certain things that, all right. So you can just ask, and then when you go make an appointment to see the other doctor, you're going for a second opinion. You're just going to hold a second. Let me just do here. So by this time you have done your research, talk to other people. We'll talk to people who maybe go on the website, the American Heart Association website, look at the different things. And again, like I said, all those different websites, they have things for general information. They don't know your whole medical history. So you might say, why they started me in this medication? Why is my doctor telling me to do this? Those sites do not, even the one with reputable sites, CDC and all, they'll tell you, you still have to go to your doctor and talk to them, because they know your history. Again, like I said, your medical history, your surgical history, your family history, your allergies, everything else that you've been taking so far, they know it. Your doctor knows it. The hospital only goes over certain things. Okay, those sites just kind of give general information, and you still have to do that. Hence the reason why I always give a disclaimer when I come on here every night. Okay, so let me just go in here. So before I go to the questions, to some of the questions you're going to ask the doctor you go for, especially, let me see some questions here. I'm going to go in here and see. Isaac Beyonce, I'm following from my Peru residence. What is the discussion about? It says I'm talking about 6 reasons to get a second opinion. You can go back and watch the show. Okay. Let me see here. What are some instances I should ask for a second opinion? Are there some case too small to that is kind of I did the 6 top reasons to go for, like, again, like I said, you can always you can have ask a second opinion for just about anything, but I did do the top 10 6 ones. There are more to it, but I did the top 6 ones that I can think about right now. And I'm gonna do my article, the top 6 ones. Okay, so you can go back, but I'll just kind of summarize when I'm all done. All right. And so, what are some other cases that I should seek a second opinion? Okay, I think I answered the first question there. Alrighty, let me just see here and go. Stanley Thomas Avon say he's watching. Thank you for watching. And let me see what this person says. Michael Newton, I'm an acting National Youth Chairman of the Liberian Transformation Party. Okay. It's a pleasure connecting with you on this platform. Thank you. I hope you have a health question next time. But I'm sure you guys doing a really good work there with the youth. So thanks for that. So going back to some of the questions you're going to ask when you go for years to see this other doctor, because now you have all your test results, everything this other doctor here told you that, so you go to see this other doctor. So some of the questions you're going to be asking, okay, use some of the questions you say, could there be any different diagnosis or explanation for my condition? You say, okay, this doctor told me this is what's going on. I just need to know, could there be anything else that's going on that's causing this and it's not what this other doctor's saying? Again, you be asking the question, what treatments do you recommend for it? So if there's anything different, what treatment? Some doctors say, let's try something else and see. Are there other viable treatments that I should consider? Again, like I said, if they say you need surgery, you can say, okay, I can't afford to have surgery right now. I have so many things going on. Is there anything else I can do that can hold me over until I have surgery? Because they say if you have to have knee surgery, you have to have knee surgery. You're going to be in a hospital for a couple of days, pending. If there's no complications, then you have to have short-term rehab in the hospital and then go to a nursing home and all of that, so that you're taking time off from work, you're taking time off from your family, you're talking about pain. If there's any kind of infection, anything that arises after the surgery, you may have to go back into the hospital to get more surgery. So all of that, when you take all that into consideration, you might say, okay, I'm just going to hold off for now. Okay. And if they say you can hold off from it, if that's not what you want to do, you hold off on it. All right. Are there any viable treatments? Are there any additional tests that I need to have? Let's say if you have CAT scan and this is what's showing, it's okay, I will do an MRI depending on your insurance again, because again, like I said, if you have to pay out of pocket, that can be a little more expensive. But most doctors would do all the testing that you need to be done to get a definitive diagnosis. What happens if I don't receive the treatment? Again, like I said, are there any side effects associated with the treatment options? Again, like I said, if you have surgery or other things, complications that may arise from that surgery, you want to be ready for that. How long is the recovery period for each treatment option? It may not be surgery, but it may be something else where it's just, let's say you have to get something off your skin, a skin mold, or they have to do something. You have to go for like a colonoscopy where they went in there and saw something else and they have to go back and move things around, there's so many other things that could happen. So what could happen after that? They can explain everything to you. How much would the treatment cost? Again, we all live in a country where we have insurance, and even if you live somewhere, other places, I can talk about national insurance and all there. I'm sure they have their issues too. So can you afford to do anything extra right now? Can I afford to do this? Does the place have payment arrangements? Can I do other things in addition to that? Some people end up going out of the country where it says it may be cheaper to get something done out of the country. I see things like that. But then you have to make sure, those countries have regulations. Some countries don't have certain regulations, and the treatment there may be cheap, but you go there and then you end up being there and having complications and having some serious, some up to and including death. So make sure you do your homework very, very, very carefully before deciding to do something outside of the country. Because if anything happens to you, your family has to go over there and get you. And even if you don't die, they still have to get you, pay for the hospital bill and everything to get you back here. Okay. So, don't feel that you're being difficult when you have to ask for a second opinion. Like again, like I said, you don't have to be disrespectful, you don't have to be rude, you don't have to say, oh, I don't know this person talking about. Sometimes even your body language, you don't even have to say that, your body language could say it. But most doctors, most providers would say, if you want a second opinion, sure. I have gone for a second opinion myself, and it's from somebody who I knew, and I said, let me just ask another person. And even if they tell you, okay, the other doctor tells you, yes, this is what you're looking at, and this is, and is close to what the other doctor said. At least you know that, okay, All right, I feel good. Now I know that two people said it. I feel good. If one person said you need to have your leg chopped off, and the other person said, "Oh, you just need some injection," you'd be like, "Okay." Then you may have to have a third opinion because why are their treatments options so vastly different from each other? Like again, like I said, some doctors are very conservative with their treatment, not really political conservative, and some doctors may say, "Okay, let's wait a little bit." And so you want to see, but most doctors will work within the confines of the regulations and everything, and the algorithm. Okay, if this has happened, this has happened, and we do have to follow where our guidelines. But again, like I said, some doctors may do something different, some doctors may do something different. So I'm just going to summarize and then we'll be done for tonight. Okay, so thanks again for joining me. So again, go back, you can go ahead, and there's so many things you can go for second opinion for everything. Some things maybe, if you want to go ahead and spend the money and go for something minor, that's up to you. So but the 6 top reasons so far: get a second opinion if you have undergone treatment for but your symptoms continue. Get a second opinion if you're diagnosed with a rare disease. Again, like I said, there's so many rare diseases out there and there's not too many research based on the disease. Get a second opinion. Get a second opinion if the recommended treatment is risky, it involves surgery, is invasive, or has lifelong consequences. Get a second opinion if you're diagnosed with cancer. The big C word. Some people want to make sure that you get that first. Get a second opinion if your gut reaction tells you something is off. Okay, trust your gut, trust your instinct. Okay, and also everything I just read. Get a second opinion if though all of that includes if your patient is your child, if the person you're taking your child somewhere and you're feeling that okay, they just told me my child has cancer, or they told me my child needs surgery, or they told me my child is diagnosed with a rare disease. You want to make sure that you check first, get a second opinion, and do all that. Okay, so again, do everything with discernment though, because we live in a world right now where people go on the internet and they think that doctors don't go to school to learn these things. We just picking things somewhere and trying to make you feel good, or trying to tell you something to harm you, or we just doing this so we can make more money. I know most people say that, or you guys just making you just doing this so you could have just told me that on the phone. You could have just told me that. What then the office just tell me stuff like that? No, because the office can just tell you your test results, unless if everything is fine, they will tell you that. If you come in, I'm responsible for explaining everything to you and saying, okay, now that we see these, we have to move you forward. Okay, so let me see any more comments. Jackie said, today's topic speaks so close to me because I can relate to all of this. Yep. I mean, it's that many people can relate to, especially if you're chronically ill and other people who have other and things that, I mean, affect their life all through. You want to make sure that if they tell you, you say, okay, let me just check, because I'm not just going to go do surgery on my leg. I'm not just going to go do surgery on my back, on my eyes, especially your eyes and all anything that would affect your livelihood. You want to get checked, but you want to have a good relationship with your doctor where you know that doctor is telling you the right things, and also he or she may be okay. If you say you want a second opinion, you go for a second opinion. Okay, they're not going to get all mad because you want a second opinion. So there are some that Jackie said there are some who presently faced with decisions where they are unable to connect to a second opinion and they are not crying. That is true. That is true. I mean, I sometimes you see all those shows on TV too, where and it's like, oh, who did that surgery? And you're like, oof, really botched that surgery. Which doctor did that? And I mean, of course, there again, doctors are not gods. Nobody, no profession knows everything. That's the reason why we would do certain things. We tell you, okay, we need you to go see another. And some patients will come to the office, and I will tell them stuff. And I said, no, you need to go see the specialist. You need to go see the specialist. And they're like, well, I went to so many different, and I don't want to. And why can't you just fix it here? No, because it required a set of different eyes, different training that is outside of my scope of practice. Now that I just refer, and it's not second opinion, because you're coming to me, I'm doing things that was within my scope of practice, and I'll tell you if you need to go somewhere and I need to refer you and I don't, that's malpractice. Okay. And also, again, sometimes you may be somewhere where you live in a small town, not even small town. You can be a big suburban town and you may have to go to a hospital. We send a lot of people to Philadelphia Center City hospitals where all these different universities are, and the doctors can do, they have all these different research going on, and we can send you there, especially for rare diseases too. So there's some things where people will have and nobody's ever heard of, or maybe there'll be like 1 out of 10 people, maybe 1 out of 1 million people in America has it. And so you know that if you live in a small town USA, the doctors over there, or they don't have the hospitals that are equipped to do even more testing, they're going to tell you, say, okay, you have to go. And during those times, the insurance company will pay for it. Some may be with restrictions, but if it's a rare disease, the insurance company will pay, pretty much pay for it because you need to get the care that you need. Okay. So let me just see. So again, make sure you go in there, you're asking, and don't feel bad. Your doctors and your providers will not, if that person is very, secure in their own professionalism and all, they would just tell you, okay. Sometimes people ask me and I say, no, it's right there. This is what we're seeing. No, and I was like, okay. Okay, if you don't want to get any treatment right now, you want to think about it, go home and think about it some more, talk to the people that you need to talk to, and then come back and we can talk about it. You don't have to make any decisions this minute. Okay. Stanley said most of our people back home, something, I went to the hospital and the doctor did all the tests and they can figure out what's going on with me. I think this is African sign, and they go see the country doctor. Is this advisable to recommend people to see the country doctor? No, it's not advisable, because now you have to remember, I train in modern medicine, so I can't say go to the country doctor, because the country doctor, or whatever medication or whatever herbs they're using, it hasn't been tested. You can say, well, they put this thing on me and it was fine for my aunt, it was fine for mine, this and all that. But when we do new medications over here, we don't, it's not just saying, okay, we're not going to put that medication on the market simply because we tried maybe 3 or 4 people or 100 people, and then okay, we put it in the market for 100 million people to use. Okay, so it has to be, you have to go through all these different testing, you have to go through all these clinical trials, it's this whole big research that goes along with it. Again, when I talk about Liberia, we probably have all these different herbs and everything that could probably cure cancer, that could cure AIDS, and it's not just limited to Liberia, to third world countries. And we have all these different things there. If the government could get together and build like huge research labs and everything, and just put enough money into healthcare, where we can get people to get into these different clinical trials, we could basically become like the health center of the world and do all that. We have the smart, we have the brains, we have the smarts, we have people there. But if that's, that again, that goes to what the leaders want to do. What do you consider important? Because I know some people, we live in a country, Liberia, where everybody cares about politics, and they don't care when it comes to healthcare. They only pay attention when there's something serious going on. They don't, nothing else matters unless it's something, you can't run a country where you're just waiting for something to happen, a pandemic to happen, before you gather everything. Okay, I was watching a show last time where they show some of the clinics, and you're like, who will even have anybody go into that kind of clinic looking like that? There's so talk to your government. But going back to, getting off my tangent, no, I wouldn't recommend that. Now, there's some things where, if you don't have a choice, if you live in a country and you can't afford to, you don't have this huge research hospital, modern hospitals, Western medicine, or medicine people who are like trained to do other thing other than that, how can you prove that? Then what if something happens and the person dies? And then what would you say? They'll be like, okay, yeah, somebody else did something again. So we don't, even in Western medicine, we don't know everything. We don't know any doctor that tells you, oh yeah, when you come to America, we know everything. You come to in England, you go to this, we know we don't know everything. So it's important to speak to your people, speak to your leaders, speak to your political leaders and all that. Demand that. If you don't, you're not going to get it. Because these people come to Western countries or go to other African counterparts, and they go to get the best of healthcare. You should have better healthcare over there. This is something I've been talking about. This is one of the reasons I started this platform for a long time, because every time you talk about healthcare, you got lost in all the politics and all the other things that come on in different forums, and nobody pays attention to you. So, but it's important. I wouldn't suggest it. Now, you can put your Vicks on, but again, if you have pneumonia and you need to get chest X-ray and you need to get antibiotics and all, that Vicks is not going to work. Growing up, we had Jolobo, we had, was it Dunner Grease, and all those different things. All like, those are all in medications that those be in addition to what it is that they're treating you for. So if you have pneumonia and they get you antibiotics, and you want to rub the Vicks on you, you want to do this, you want to do all this other stuff, that's okay. You can do that in addition to, we'll call that supportive care. But you do need to go to the hospital and get the care that you need. Unfortunately, it's not always available everywhere. And even in America, sometimes it's not always available. And some people don't have the money to go for extra care. So, we all, even in America, to make sure that you vote for people who are, will make sure that the healthcare system is up to par, and this is spread out fairly, because some people can afford it, and the rich people shouldn't be the only one to get the best of care. We should be, but at least we have the basic access to basic care over here. So I wish for the same back home, you know, and we have a lot of people who go back home every year to help out too. So kudos to them. Most of them are my friends. So kudos to them, and people who are out there who are there and doing the best they can with what they have. So thank God for that. All right. So I think I got all the questions there. And again, like I said, second opinion, I did go back. So for those of you who just tuned in, you can go back there and watch the show and see the reasons why I give. And if you have any further questions or comments, please leave them below. If you like this presentation, please give me a thumbs up. If you haven't joined so far, please hit a follow button so you can get a notification so you don't miss any show. Come on Tuesday at 7 o'clock and Friday at 7 o'clock. I will be doing some other things different on Friday, maybe having a low chat, but I do want to do some nursing stuff because I was a nurse before, and I did a lot of precepting and was a mentor to a lot of newer nurses and returning nurses. So I want to be able to do shows like that too. Okay, so I think I got all the questions so far. Okay, so we'll go there, and okay. Alrighty, so if I don't see any other questions, so thank you all for watching. And I will see you guys on Friday. I'll probably come on before then, but I'm not sure. But thanks so much for watching. I didn't think this show was going to last this long. Thanks for watching. For those of you who watch now, I say thank you. For those of you who will be watching later, I say thank you. I appreciate all your love and support. Good night. God bless.